So what's really great about the Heart to Heart program is that heart failure is something that affects our patients in such a strong way in their quality of life, and it's the #1 reason for readmissions to the hospital. So we really had looked at what could we do to make really have an impact on this, and we found that medications and safety in the home was really a big part of why patients are readmitted to the hospital. So we looked at partnering with the pharmacy group, and Kelley-Ross was excited to work with us on how can we better transition our patients from the hospital to home.
So this program has been very exciting for us. It started off as this hospital to home program when patients were leaving the hospital, going to their home, and we were there to help make sure that transition worked well. Now we're seeing this program evolve and really progress to the next level. So now when they leave the hospital, those patients that go to a skilled nursing facility, we're able to then follow them after they leave that nursing facility, go back to their home to make sure that they also have a good transition to achieve better outcomes.
So in doing this project for the last year or so, we've worked with our patients and found that as we have Kelley-Ross go into the home and really work with the patients in their living, their true living area, where they are and how they're back home and trying to deal with this issue, that we were able to identify a lot of opportunities to really improve their care and their outcomes. So we had done a lot of work in the past, and we had a readmission rate of about 20%. And after partnering with Kelley-Ross and having their pharmacists in the home and really working with our patients in a different way, we found that we were able to decrease our readmission rate from 20% to 8%, which is off the scales, just an amazing change.
So seeing this reduction in readmissions is extraordinary because it shows so many possibilities on how not only are we improving the health of patients, but we're improving their quality of life.
This is going to be great because it's going to give the patients a more sense of security when they go home. We can set them up for a safe discharge as much as possible, but managing meds, it's just going to give that extra safety blanket. So hopefully patients, don't go back to the hospital and their meds are just easier managed, and it makes it more easier because, as we know, patients sometimes have a lot more meds and it gets a little overwhelming. So
what this relationship means to our patients, I believe it can be instrumental, potentially the difference between life and death of clients receiving quality, timely care, and for those other residents who don't receive the appropriate follow-up, dealing with cardiac challenges and other services they require. By having all these services grouped in one place, we really can follow the clients from the beginning of the process to the end of the process in regards to their level of need.
So one of the questions we commonly get when we're going into the home and we're working with care teams is, why a pharmacist? Well, a pharmacist has a very unique skill set, and with so many problems related to transitions of care around medications, it makes sense that pharmacists, as unique medication experts, we have the knowledge and we have a specific skill set that really allows us to find out where problems may be happening in the home with the patient's medications to make sure that they are using medications safely, that they're using them effectively, and that they're really using them the best way within their home.
This type of work is new and it's exciting, and it's what I went to school for. Meeting patients one-on-one and having these in-depth conversations about how to get their medications to work best for them, and working to simplify their regimens and so that they can have those optimal outcomes.
Being inside of someone's home is a very interesting experience. It's both overwhelming at times. You see a lot of things that you want to fix right away, but you can't. But it's fascinating to see the difference you make. You see the difference in what you can teach the patients, what you can help them with, different ways you can help them. It could be a safety concern, it could be a medication related thing, it could be they're taking their medication just slightly incorrectly, it's making them feel bad. And if I can make them feel better, it makes all the difference in the world.
The patients I have personally had contact with have all been very positive about the experience. They start developing a first name basis relationship and tell me that, Josh is coming this afternoon, or Josh called me yesterday, or Josh showed me this.
And I can't tell you the number of patients that come back to me and tell me how helpful it was to have the pharmacist visit with them, meet with them, and educate them. They're so much more confident in the plan and also feel much more empowered as an active member of the care team. all of that serves me very well as the cardiologist caring for these patients, because if we have an empowered patient who understands their disease, it makes my job so much easier, and these patients do so much better with the help of this program.
When I'm talking with patients, they have that extra security knowing that now you've got two people there for you. You have a nurse, therapist, and a pharmacist there to look out for you, and that's a really cool thing. It's patients' eyes light up when you talk to them. It's really neat to see that in person.
We go in and we try to see safety concerns. We try to see things that not only medication related, we try to see we use a holistic approach and try to see the patient as a whole. We try to see their living situation. Sometimes it's a bed that's inappropriate for them. Sometimes it's they don't have the medication with them because they can't afford it. So it's not always the medication that we go in and try to see, but we try to see them as a whole and try to find out a better way for them to have a better outcome and for them to be healthier.
It's so exciting because we've already seen such an extraordinary reduction. Our hope is that we'll continue to see this reduction and see it progress across the continuum of care. So not just when patients go from hospital to home, but when they go into that skilled nursing facility and home, we continue to see them stay home and not end up going back to the hospital, because this has just a profound impact on reducing the cost of care to insurance payers, to the patients themselves. It improves the quality of care, and it really gives that peace of mind to patients knowing that when they go home, they're receiving the care they need, they're getting everything and only what they need to really improve their outcomes and their health.
It's just a wonderful program, and it's really exciting. We're really looking forward to seeing what else we can do as we move forward in the next couple years.